So one of the things I wanted to talk about today was ganglion cysts. So it's a fancy name for essentially what you would consider a standard cyst. Now, these can occur pretty much in any location. And of course, in my area of expertise, I would see it in the hand and the wrist. And one of the things is these things are very common. And many times I kind of give the same philosophy to patients as far as how I deal with these things. And sometimes it's received well and sometimes not. But I want to explain to you, in general, these cysts, when they occur, a lot of times I see them on the wrist. Sometimes they can be large and sometimes very small. And sometimes they can be symptomatic, but I would say the majority of the time, it's not going to cause any problem. And even if it is somewhat symptomatic, my philosophy is that I generally am not aggressive about suggesting removing the cyst. Now, one of the things that can be done theoretically, you can aspirate the cyst. So in many cases, there are physicians that do that. It's not too uncommon. One of the reasons I don't do that is because, for one, it's going to come back at some point in many cases. And then when it gets to the point that it is something that needs to be removed, it kind of makes it more difficult for me to remove it when you have scar tissue and whatnot involved in it. And then lastly, there are many of these cysts in locations which really should not be aspirated or drained, particularly on the front side or volar aspect of the wrist near important vessels and things of that nature. So in most cases, it's not something that I would consider doing. And so I usually recommend when you come in, let's say the cyst is on your wrist or your finger, and there are different names for each of these locations, different kind of characteristics of the cyst. But in general, the reason why I suggest not removing it is because it's one of those things, like there are different theories as to why they occur. But just as that cyst popped up, may have been there for a while, it can also disappear. And many times, just given enough time, it can go away. Now, the other aspect of that is that it can also get bigger and more difficult to manage because of the size may become particularly limiting to your activities. And so for those reasons, we tend to definitely move towards removal, which is an outpatient procedure. So depending on the location, kind of guides what type of anesthesia is used. Sometimes we can just numb the area up with a little sedation. Sometimes I prefer general anesthesia. Reason for that being that sometimes, depending on the location, putting a lot of local anesthetic in just kind of makes it harder to see everything that you need to see. And really, these things can be very straightforward, without all of that extra material in the surgical area. So there are different ways to kind of take it out, but the bottom line is it's a simple outpatient procedure usually, and you have stitches in for a couple weeks. Usually it doesn't require the need for therapy afterwards. And of course, depending on the location, but for the most part, after a couple of weeks, you're pretty much finished with it. One of the reasons I don't aggressively pursue these, recommend that you have to have it removed normal occasions, it's just because there's always a chance of it coming back. Now that chance is small. The percentage is kind of arbitrary. I mean, in my experience, maybe depending on the location, maybe 5%. The high end, maybe 10% coming back. But I have seen it happen. And one of the things that's very disconcerting to patients is to go through all the trouble of having a surgical removal of a particular cyst in a location, and then it comes back. And it's one of those things. Now, depending on the location, re-excision, these cysts, when they come back, is even less fun from a surgeon's perspective because there's so much scar tissue and things of that nature. So it's even, I'm even more reluctant to go after the ones that have come back. But it does happen, and it's one of those things. That's one of the reasons why I'm not particularly aggressive with it. Now, one of the things that we do when we get to the point where we've decided to remove the cyst, and I always tell, another thing that I do, I always tell patients that ultimately, whether or not this is, bothering you or not, it's really a personal decision in terms of if you want it removed, given all the facts that I've given in terms of the possibility of recurrence and the nature of just doing this, standard outpatient procedure. So, assuming you've kind of gone through that and you decide, I will, remove these things because they can be kind of annoying. There is a cosmetic aspect to it, but realize that you're exchanging basically a bump for a scar. The scar is not that big, but even in some patients, I found that, say, if you form keloid, which is a hypertrophic scar, just a thick scar. After surgery, you may have removed a bump, but now you have a scar. So these are the things to consider. With all that being said, when we do get to the point of removing these cysts, wherever they may be, it does, it's generally kind of a pretty routine type thing. One of the things that we always do anytime we remove anything, it's considered a biopsy basically. And so we always send it to pathology, even if it looks like a standard cyst. And usually what that entails is basically kind of a capsule with the material inside. It's kind of like a clear jelly. It's like literally like if you think of just regular jelly, it's just clear. And that's usually how it is. Sometimes it can be more fluid filled. Now, of course, when you're dealing with the mat, sometimes we expect to find a standard cyst and we don't find a cyst. We find a tumor of some sort. And of course, tumor doesn't always mean bad. It can be, something that fibrous. It can be occlusion cysts. There's several things that are pretty standard that I think are in terms of the, benign type situations that we normally run into. And of course, in the most rare occasions, you can find something that's malignant. But in general, it's pretty clear when we're dealing with a cyst and not something else, just clinically, even without getting further testing and things of that nature. But sometimes you can be surprised. So, overall, it's one of those things where when it comes to managing these cysts, and I'm generalizing because in different areas of the body, it can mean different things. If it's on your wrist and it's very large, it can cause, significant problems. Say you're a person that works out a lot and does a lot of push-ups and it's just kind of getting in the way. It's kind of one of those things versus maybe a little bump on the finger, which may or may not, be causing a symptom. But the thing is, going through all these, when you make a decision on whether or not you're going to get it removed, I definitely go over these options with you, the pros and cons. I always lean towards trying to leave it alone, but of course, I always listen to the patient in terms of, if it's really bothering you, we definitely take care of it.